The moments after a stroke are critical. Time is truly of the essence to get to a hospital and get care. But a new clinical trial is also shedding light on what should be done in those moments up to removing a clot. In today's Health Watch, Tirsa Smith breaks down the latest breakthrough in stroke survival care.
The 2024 International Stroke Conference in Phoenix, Arizona showcased the latest stroke and brain health science. Dr. Ann Alexandrov is a professor of nursing with a joint appointment as a professor of neurology at the University of Tennessee Health Science Center in Memphis. She was one of the experts to grace the stage.
So it was really quite an honor to stand up in front of this huge auditorium filled with thousands of people and be able to share these results.
Alexandrov presented the results of her 5-year clinical trial called zero-degree head positioning in acute large vessel ischemic stroke, or Zodiac.
So we started by looking at, first of all, do patients have increased intracranial pressure? And we debunked that myth pretty early, back in the early 2000s. And then we started looking at real-time changes in blood flow into the arterial territory based on whether you put the patient's head up at 30 degrees or down at 0 degrees. And lo and behold, we found that there was a 20% increase in blood flow into that ischemic oxygen and glucose starved area of the brain from the stroke if you put the head of the bed down at 0 degrees.
The findings? Head positioning at 0 degrees, lying flat, reduced disability. They also found that 1 out of 2 patients in the 30-degree group, which is sitting up, deteriorated significantly.
The type that benefit have what's called a large vessel occlusion. Sometimes you'll hear that referred to as an ELVO or LVO. And those ELVO patients, if they still have viable brain, because they're early into stroke, not many hours in, but just, a few minutes or maybe just a couple of hours, those patients are at a perfect point in time before you can get the blood clot out to put their head of the bed down at 0 degrees. Now, it's important to emphasize that head positioning is not a treatment for stroke. It's kind of a rescue procedure, if you will.
Her research findings could change the game in the fight for improving outcomes for those undergoing stroke care.
I know during the Zodiac trial, I actually had gotten on a plane to take a vacation. And I sat down in my seat and looked over at the gentleman who was sitting next to me and thought, gosh, he looks familiar. And I said, hello. And he said, you're that doctor that put my head down flat. And I said, oh my gosh, it is. It's one of our subjects. And he said, I was amazed that something so simple made me feel so much better so quickly.
And she hopes Zodiac will allow more patients the opportunity to have the same outcome. For Health Watch, Tirsa Smith, WATE 6 on your side.